Well, I'm so excited to introduce Medical Director of Pedre Integrative Health, medical doctor, of course, and someone who went through this experience himself. He had a bad gut and learned how to create a happy gut, which is the name of his current book. And so we'd really love to welcome Dr. Vincent Pedre. Hello and welcome.
Thank you for having me. It's such a pleasure to share my story with you guys and provide some wisdom for the audience.
Fantastic. Well, let's start right there. Tell us what happened, because you didn't have a good gut, did you?
No. And really it happened because of the best efforts of both my parents and pediatricians making what I can look back now and say were probably not the best decisions in terms of my healthcare. But like any child, I had infections and viral infections, but also I had a very weak respiratory system, lungs. If you study Chinese medicine, there's a really strong connection between the lung qi and the stomach qi, and just the interplay between those meridians is very key and important. And so I had a lot of respiratory infections, bronchitis, pneumonia, throat infection, sinusitis, and my doctors put me on antibiotic after antibiotic. You know, that was the 80s when antibiotics were the solution for everything. You have a cold, here's an antibiotic. Does it matter that it's a virus or bacteria? No, we're going to give you an antibiotic. So I calculated that I had been on 20 plus rounds of antibiotics as from the age of 10 through my teenage years, through my late teenage years. And, you know, all I knew then is that I had a very sensitive stomach, and there were certain things that I couldn't eat, and it would be very sensitive before any test, any major event, any performances. I used to play the piano, and I can't tell you like the somersaults I felt in my gut before I went on stage. But what I understand about it took me probably over 2 decades to really understand what happened, that all those rounds of antibiotics destroyed my gut microbiome. I mean, how can the microbiome recover if you're on 2 to 3 rounds of antibiotics per year? And as a result, I had developed an imbalance of good, bad bacteria, which led to leaky gut syndrome. And because of the leaky gut syndrome, I developed sensitivities to the 2 biggest food groups in a teenager's diet: wheat and dairy. So there was, and a lot of times they were combined together. So it was cereal with milk in the morning, maybe there was a sandwich in the afternoon, and you know, bread at dinner time, ice cream for dessert, milkshakes. So I was eating all the things that were wrong for my gut. And as a result, I suffered from a weakened immune system for years, anxiety, sometimes bouts of depression, skin issues as well. Eczema later on came on as triggered by gluten. So I figured out that I had become sensitive to dairy proteins as well as gluten. And I didn't figure that out until I was in my mid to late 30s. So it took me a while, and I had already gone through medical school and done the traditional Western training, but I had also been really fascinated with yoga and meditation and alternative medicine. And I was always looking for the answers that weren't being provided. And intuitively, I just felt that there was more to the story than just you have IBS, irritable bowel syndrome, and take this medication and that's it. We're going to treat your symptom. You live with this condition for the rest of your life. And honestly, there were periods where I just thought, this is my normal, and I just have to accept that I might eat out and then have an upset stomach. And I don't know what caused it. But it was because I really didn't know underlying causes. I didn't realize that my gut microbiome was completely imbalanced because of all the antibiotics I've been exposed to, and that I needed to heal my leaky gut. And when I got all those things in order and started healing my gut, that's what really started me on this journey that led me to work with patients on their own gut issues. And that part of my practice just blossomed. And then, of course, you know, once you start seeing gut issues, then you realize, oh my gosh, like everybody has gut issues, whether they realize it or not. Everybody has some sort of foundational gut issue because so many people have been exposed to antibiotics, you know, and so many people in our world live under high degree of stress, which I tell people stress is like an attack on your gut, and it also increases gut permeability and affects the balance of the microbiome. So one thing led to another, and I realized, wow, there is a world of people out there who don't know this information. This information is really simple, you know, like it's about taking out the inflammatory foods in the diet, rebalancing the gut microbiome, and healing the gut lining. So I put that together into this program that I created that I call the Gut Care Program, Cleanse, Activate, Restore, Enhance. And that was what I had developed working through functional medicine, understanding the functional medicine approach, and wanted to make something that was accessible to the many and reach many more people than I could possibly reach in my one-to-one medical practice.
Before we sort of dig deeper on that one, I just want to go back a point because you said something really interesting at the outset, which was you found there was a link between respiratory disease and chronic gut problems. In your case, it was clear the culprit was antibiotics, but have you seen cases where that wasn't the problem, that in fact it was somehow linked to respiratory problems instead?
Oh, could it be independently a respiratory issue? Yeah, I mean, of course, the body is a complex symphony, and there can be multiple, sometimes converging cause-effect relationships in the body, you know, and that's how we look at systems biology. Is like the body is this complex symphony that you want it to play harmoniously, but things can go out of balance, you know. So if you smoke, you're affecting the lungs directly, right? Sure. But what I did find, and I think is very significant even now with what's happening in the world, is that once I started healing my gut, and I have seen this with patients, my infection rate dropped dramatically. And it's because if your gut is leaky, if your gut is inflamed, you're fighting an ongoing immune battle all along the gut lining. And that lining has an incredible surface area. You know, the small intestine alone is as big as a tennis court in surface area. So it's a really, really big battleground. And if that is going on, then there is a virus that comes through the respiratory passages. It's going to be harder for your immune system to develop an immune response quick enough against that invader because it's so distracted in the gut with what's going on in the gut. And it was my first and primary motivation as a child was, how do I not get sick? Because I got sick, I couldn't be around sick people. Like I caught everything. And the pediatricians thought, you know, he's not eating enough. I was really thin. I was like rail thin. And they wanted to give me multivitamins, but they just didn't realize that the true answer was my gut. because the gut is the gateway to your immune system. And I find it really interesting, even just beyond Chinese medicine, the way the embryo develops is when the cells fold inwards to create the tube that becomes the digestive system. It's that same folding inwards that creates the entire airway system. So in a way, the same types of cells that create the airways are the ones that also create the digestive system. So I also think of it that way, that there's this interrelationship, interconnectedness between the two. And it's so important to have a healthy gut, to have a healthy airway. And it's also really interesting, if we talk about mental health, that in Chinese medicine, the lungs represent the emotions, especially if there's lung qi imbalance, then you will have a patient who is depressed. And what we understand now about the gut-brain connection is that if you have a leaky gut, you have a leaky blood-brain barrier. And if you have a leaky gut, your gut is on fire, and your brain will be on fire. And when I say fire, I mean inflammation, biochemical inflammation. And a brain that is inflamed is a depressed brain. So again, seeing the interconnection and realizing that really the true healing has to start in the foundation of the body, which is the gut. I called it in January, I wrote a post and I said, the gut is the cornerstone of your health. And if you look at architecturally, historically, cornerstones were the first stone that was laid down when a building was being built. And it was memorialized usually with an engraving. And the cornerstone would determine the location of every other stone in the building. So it was the primary, it was determining. And I look at the gut that way because the gut is the cornerstone of your health. Mm-hmm. And if you don't have that cornerstone, strongly built with a good foundation, then the house of your health is not going to be standing on a firm ground.
Let's talk about, first of all, what did you have to do to heal yourself? Then I really want to get into this whole idea of the brain gut connection.
Yeah, first of all, cutting out gluten and dairy completely, like just completely eliminating them from my diet. And then there were some other foods that I had looked at. I had done food sensitivity testing because I really, at that time, I still was kind of more, and I still am, but I needed evidence as a doctor. And so I had looked at some food sensitivity testing that proved that I was gluten sensitive, because that was a really, I have to say, that was a tough choice to make, because I had to completely redefine how I ate. And especially if I was out at work, like I'm not going to go get a sandwich now. So I had to you had to reprogram the brain on how is it that I'm going to live and eat. So there was, as part of my journey, there was a mindset shift. And there had to be a reprogramming of automatic behaviors that had existed for decades. I had to change, okay, lunch is no longer a sandwich. So if it's not a sandwich, then what is lunch going to be? And how am I going to make it so that it fits into the profile of what I need to eat to be healthy and also have energy? So that was the other thing. When I was eating gluten, I would feel so tired at work by 3 or 4 p.m. I just wanted to take a nap. And honestly, if there was a bed there, I would have just put everything on pause and I'm going to go take a 20-25-minute nap, and then I'll come back and keep working. But I wanted to biohack that. I wanted to figure out, okay, why is this happening? Of course, it was related to the gut. It was related to gluten. When I took gluten out, I had this surge of energy within weeks. I could work a 12-hour day without having that slump in the afternoon. So first, dietary approach, at home, making a gluten-free household, as well as really going organic on vegetables, really focusing on where our food was being sourced from, and cleaning out the diet, lots of healthy fats, olive oil, avocados, things like that, coconut oil, and then bringing in probiotics, fermented foods, as well as taking, at the time I used L-glutamine. I mean, since then, it's, these formulas for healing the gut have really evolved. But L-glutamine is one of the primary amino acids in the body, and also the main energy source for the cells that line the small intestine, the enterocytes. And thus, if you give them their primary energy source, then it allows them to heal, because now they have all the energy that they need to do all the processes that they need to do to upkeep themselves and reseal those tight junctions. And you're taking away the foods that are causing problems. I did stool testing to see if I had any gut infections and treated that. And then just really time and patience, and deciding that it was going to be my lifestyle. And initially, when the biggest thing was gluten, as I said, and when I first removed gluten, I thought, okay, this is a 3-month experiment. Let's see how I do, and then I'll introduce gluten again. At 3 months, I think I was out to brunch and had some bread. And within 10 minutes of having the bread, my wrist here turned slightly red and got itchy on both sides. And I thought, oh, that's kind of strange. That hasn't happened before. And I thought, okay, maybe there's something here with gluten. So I went on another 3-month avoidance of gluten. And so at 6 months, I thought, okay, let me test it again. I have some bread, and there it goes again. Faint little redness and itchiness. I mean, go figure why the inside of my wrist. I mean, it's different for everyone. I've had patients who have avoided gluten, reintroduced it, and then they break out in full body hives. So for me, thankfully, it wasn't hives, but it was enough of a sign. And now with a repetition of the same sign under the same circumstances, I knew, okay, gluten is a problem. So 6 months, I'm like, okay, I'll do another 6 months. So now I'm get to the year, and I try it again. Reaction is still there, not as intense, milder. I'm like, okay, I guess gluten is a longstanding issue. And at that point, I started accepting that this was not a temporary measure, that this was going to be a way of life for me. And I think that was really important too, because I guide so many people on this. And I think it's important to understand what they go through when you ask them to make major dietary changes that will have a really positive impact on their lives. But they, at the same token, they've got to let go of old patterns. And that can be really hard to shed. Even years after that, so that was, God, what year did I go gluten-free? That was like 2008. So even years later, if I was at I don't know, if it was New Year's Day and I was at a restaurant that made their own homemade French toast, like, okay, I'll have some of this. I know that there is a price to pay, but I also knew at that point I had done so much work in rebalancing my gut that even if I did have a little bit of a reaction, usually the stomach's upset or IBS-like symptoms would happen 1, 2, or 3 days later, but I knew I could recover quickly. And thankfully, with all the work I've done, I actually had a parasite just about 2 months ago. And I had to take an antiparasitic, but then I knew exactly what to do right after that. And I got into my bone broth, cooked vegetables, and I was able to turn things around really quickly, which goes back to what I was saying. The more you build that foundation of gut health, the easier it is for your gut to bounce back from things that happen in life. Because look, the reality is antibiotics are life-saving. And even with people who have been on antibiotics and done a lot of gut healing, they might go to the dentist and then find out they've got an infected tooth and they need to go on antibiotics. So, okay, but we can deal with that. But I can tell you, the stronger the foundation, the easier it is to bounce back from that.
Yes, yes. Let's talk about that really important connection that you discussed about the connection between the brain and the gut, and why emotions will affect the gut or vice versa.
So important. I mean, I know this is your thing, and I love the work that you do. I was really fascinated with this and the connection between the brain and the gut through the vagus nerve. And it turns out that the vagus, and I'm sure you know, has most of its fibers pointing up from the gut to the brain, then down from the brain to the gut. So it's about 70% of the fibers pointing up. And in those nerve endings that innervate the gut, which do a bunch of things. I mean, this is, to me, I mean, I feel like you could just be a specialist on the vagus nerve. The vagus controls peristalsis, so the rhythmic contractions of the gut. And it also controls secretion of digestive enzymes. So when you're feeling stressed and suddenly food is just not sitting so well in your stomach, you know, there are those people, they feel stressed and then they lose their appetite. If they eat, they feel like it sits like a rock in the stomach. Well, it's your vagus. Your vagus, when you're stressed, does not fire properly. And then your enzyme production drops. Your peristalsis, so the contractions of your small bowel, also slow down. And that causes upset stomach. But on the other side, so those nerve endings in the gut, they have receptors for serotonin. They have 5-HT2, 3 receptors. And so serotonin, which is our happiness molecule, is produced primarily in the gut. And it's produced by gut bacteria, which is quite fascinating that gut bacteria produce all sorts of metabolites that have an effect on our nervous system. Because if you think about it, gut bacteria are single cell organisms. And why would they need to produce something that sends a message? But they do communicate with each other, and they communicate with us. And there's been studies showing different types of Lactobacillus plantarum, Lactobacillus GG, and they produce active neurotransmitters, GABA, that influence the firing of the vagus nerve. So they also, in some ways, control vagal tone in the direction from the gut to the brain. And when you get the stimulation of those serotonin receptors in the gut, what you get in the brain is the release of GABA, which is an inhibitory neurotransmitter in certain sections of the brain. So it kind of helps balance out overexcitation in the brain. And that's coming from that connection with the gut. And as we know, the gut is the second brain. Or if you were looking at it differently, you could say your gut is your primary intuitive brain. And it always knows before the logical frontal brain comes in and tries to dismantle it, tries to reason. But your gut is always correct, right? There's an intelligence to the gut. And like I said, that interconnection between inflammation in the gut and inflammation in the brain, which has a lot to do with something called endotoxin or enterotoxins that come from gram-negative bacteria. And when you have a leaky gut border, more of those endotoxins that are released by gram-negative bacteria that normally live in your large intestine, what happens is that endotoxin gets absorbed and it stimulates receptors on white blood cells, but also in organs like the liver, your muscle tissue, And it also crosses the blood-brain barrier and goes to the brain and can affect the same, so it can stimulate the same receptor in the hypothalamus as it does in the other tissues, which is called a toll-like receptor 4. And when that receptor gets activated, it turns on an inflammatory cascade inside the cells. And so thus, that is the connection between what is happening in the gut and what is happening in the brain. And we can also tie it into diet, because it seems that certain types of foods can increase the influx of endotoxins. So if you have a person who's been on antibiotics, who's eating a lot of sugar, who's maybe drinking alcohol, and then is eating a fatty meal with fried foods, saturated fats, that's going to cause a postprandial, so post-meal endotoxemia. And you get that endotoxin coming into the body, which causes things like weight gain, insulin resistance, so more fat in the middle, and then it puts your brain on fire. So you're going to feel stressed, maybe you feel depressed at the same time, you feel anxious, and it's all because of these environmental factors that are playing in with our own genetics and causing what the person is feeling on the outside.
And is it possible you can have this chronic depression or anxiety without having any obvious gut symptoms that manifest as well?
Absolutely. And I can tell you, I've seen many patients where they have what I call gut-related symptoms without any gut symptoms. And I've had patients, for example, presenting with all sorts of inflammatory autoimmune antibodies in the blood test, skin hives, severe fatigue, and joint aches with normal digestion, absolutely normal digestion. But when I did a stool test, what I found was yeast and a parasite in a completely asymptomatic person. So I always say, you know, that there is gut health and there are gut-related health issues. You have to understand it's like one of those diagrams with a lot of lines going out. The gut is in the middle, and then there's all these tangential things, the brain, eczema, asthma, allergies, mental health, anxiety, all of that can be interrelated. And it's really interesting, the connection, again, with the vagus nerve and even just thinking about heart rate variability and the resilience of the person to external stressors, because they found that even just vagal nerve stimulation can have a reversal effect on chronic depression.
I should also explain for the listeners out there that they tend to call the vagus nerve the love nerve. You know, we have a love hormone, which is oxytocin, and the vagus nerve is, as Dr. Pedre described it, is the longest nerve in the body, and it starts at the neck and it winds its way through all the major organs of the body. So it has huge effects, as well as on the gut. What I'm really fascinated by, and it also is involved in oxytocin release, so hence why they talk about it as being the love nerve. And some of the work I've seen has demonstrated that when that vagus nerve is turned on, essentially, and is in that kind of, if we do something compassionate, it also has profound effect on our mood, our relationships with people, et cetera, et cetera. What about the reverse, though, Dr. Pedre? When somebody is depressed, how does that affect their gut?
Yeah, and I just want to say something about that. You know, when we do acts of kindness, compassion, that also triggers oxytocin release. And I've been talking about inflammation and stress, and I didn't mention cortisol. Cortisol being one of the bigger stress hormones produced by the adrenals. Well, your antidote to cortisol is oxytocin. And it's so important for even just the health and well-being of the body. And the other thing I want to mention is the importance for healing. And I'm really convinced of this after 20 some odd years as a doctor, that in order to heal the body, you need to get the person into the parasympathetic, relaxed state. You cannot heal when your body is in fight or flight or hyper alert. You've got to get people, and we also call it the rest and digest, because the vagus stimulates not just rest and relaxation, but also digestion. And it's so important to get the person into that place where they feel safe within their bodies, and that's where healing can happen. So I'm sorry, I digressed for a moment.
No, that's all part of it.
What do you do to achieve that state for your patient? Do you suggest meditation or?
Absolutely. I think it's really doing things that you love, but also things that we know through science that work. So, and honestly, I kind of like sometimes lay it out for the patient, kind of like a menu, because some people aren't good meditators, or maybe they need guidance. So do meditation with an app, or maybe use heart math to work on heart rate variability and heart coherence, but also gratitude, journaling, doing something that they love to do, where time just seems to stop. These are things that are going to trigger oxytocin release, which then lowers cortisol levels, gets the body into a more relaxed state of being in relationship with others, connecting with friends, family. I think that is also really key and important. Seeing each other, because the most communication that happens is visual. It's not even through the words. It's really us seeing. And I've noticed that when wearing a mask, a lot of times people need to ask, can you repeat that? What did you say? Because they can't see your mouth.
Yeah.
So, and really a lot of communication is expression, facial expression. We have so many muscles. But I wanted to get back to your question, which I'm going to ask you to ask me again because I went on such a tangent.
No, that was a great tangent and really important, this whole idea of getting into that parasympathetic state. It was about, okay, let's go from the brain to the gut. So feelings of depression and upset, et cetera, what does it do to the gut?
Absolutely. So when you are in a depressed state, when you are in a stress state, that's also going to lead to vagal nerve malfunction. So you're going to lose vagal tone. And as a result, they've looked at this in patients with traumatic brain injury. So if you have a traumatic brain injury, within 30 minutes of a traumatic brain injury, your vagus nerve firing becomes dysfunctional. And as a result, you develop leaky gut. Well,
wow.
Who thought that gut permeability was also under control from the brain through the vagus nerve? So it's not just that it's happening in the gut because of that imbalances of the gut microbiome, of parasites, yeast. It's also top down. Your brain is controlling the permeability of your gut barrier. Oh. And I think it's really fascinating to me when you start looking at the types of person that come in with leaky gut, and you start thinking, okay, so the gut is this physical barrier, but we also know the importance of maintaining energetic boundaries. And a lot of people that I've met with leaky gut have very poor energetic boundaries. They don't know how to create boundaries around themselves with other people. They let people take from them. They're not protected in that way. So it's quite fascinating how I've made the correlation. And this is not like a formal study, it's just an observation with patients that poor energetic boundaries are kind of a sign of potential leaky gut as well. But we know from traumatic brain injury that there is that control from the brain, and that the patient with traumatic brain injury, you have to put them on really high doses of omega-3s to really cut down the inflammation, because their gut becomes very leaky when they lose that vagal tone. So just think of it in a person who has chronic depression. It's not a traumatic brain injury, but it is an altered state in the brain that's going to affect proper neural signaling, and that will affect vagal tone as well, which then can also be another contributor to leaky gut. And as I said in the beginning, you know, the body is this incredible symphony that is happening all at once, at physical level, at energetic level, all of this going on at once. And there's never just one simple cause effect in the body. There's a confluence of factors that when you sum them up, they create what is happening in the body. And the skill of what I've seen working with patients on these issues is that the true healing doesn't come just from a gut approach. True healing comes from mind, body, and spirit approach. I can't take every patient on that journey because not everyone is ready for those things, because a lot of times that means healing things that they might not want to look at. But that to me is the ultimate healing pyramid, is physical, mental, emotional, and then spiritual at the top. And that's what's required for true complete healing. And if I can I share a story?
Please.
Yeah. So as I think as much as I wrote Happy Gut for the thousands of people around the world that it has helped, writing Happy Gut also helped me. And during the process of writing the book, I was working with an energy healer trained in the Brennan method, and learning a lot about my energy and how I held my energy in the lower chakras. And as we know, the gut has the intersection of three very key chakras: the root, the sacral, and the solar plexus chakra. And I started finding that I had healed a lot. I'd healed almost, let's say 90%, but there was still that 10%. And that 10% had to do with energetic interplays. A lot of it can happen through the third chakra, through, because the third chakra is will and power. And this is where I get into my yoga background and Eastern philosophy. But when there's a power struggle, a lot of times you'll feel it here in the third chakra area. The person might come to me and tell me, I have an upset stomach, I have acid reflux, so they're feeling physical sensations, but behind them, there might be some sort of, and there could be a physical, but there might be some sort of energetic imbalance. And when I was working with my energy healer and really worked on the energetic imbalance in that area of the third chakra, that healed the last 10% of my gut issues. And a lot of people may not realize this, but if they have sensitive stomach, it could be because of physical causes. But they have to also see that the stomach, that whole area of your body is how you take in the world. And if you are an empath, if you are that type of person who feels a lot, you're going to be feeling it through your gut. And it's quite a challenge, because as we're growing up as children, we're not taught how to handle that. right? Because most people, parents, they don't understand that. And the way to handle that is you have to learn how to create proper energetic boundaries to keep your system protected and whole. And that to me was another piece of the picture. In my book, I write about meditation, I write about gratitude, breath work, all really important things to really access and address that more spiritual aspect of the healing process, which has to do with healing, the gut at a physical level, but so much more.
And you've mentioned, just to complete the profile, you mentioned the person with a leaky gut often has leaky boundaries and allows everyone in and takes advantage of them. I think, and similarly, they also in self-denial often, aren't they? They don't really, allow their true selves to, really manifest.
Yeah, they're not in, they're pre-aware, I guess. They are pre-aware of what is going on. And I can't tell you how many times I've worked with people and, they come to me with a physical symptom and we end up talking about their job and how their boss takes advantage of them and they don't know how to say no, which by the way is a boundary thing. And we sometimes, as a doctor, I've told patients, I'm like, look, I don't want to turn your life upside down, but I think you need to look for a new job. This job is not fulfilling you and it's affecting your health. And sometimes patients have actually found a new job, manifested what they wanted, like really worked on like, what is it that's going to bring them happiness? And then their whole body can relax and feel better. Sometimes they haven't moved jobs, but even just having the conversation and bringing it into awareness has allowed them to create an internal shift on how they're relating to those external stressors. And then the stressors don't affect them in the same way. And I think that is the key, because again, it's about developing energetic boundaries that will support your gut boundaries.
No, I think that there is something so true about that. Looking at, cases of spontaneous healing, like of cancer patients, the work done by the Institute of Noetic Sciences, and they find that something like 1 in 8 patients with certain kinds of cancer have spontaneous healings. And when they drill down a little more, they usually see that it is something to do with changing their lifestyle, getting out of that sense of being a trapped rat, where life is never going to get any better. And once they do that, that seems to make that mental shift, emotional shift, makes a physical shift.
And I think, like you said, it's dealing with the emotional body as well. So, and there can be some really, really strong trapped emotions, and depending on how the person develop their emotional intelligence, they might get into a conflict with someone, feel angry, but they don't know how to express that in a constructive way. So instead they keep it in, they swallow it, and it stays here in the gut. So then they have an upset stomach. So they've kept their anger in rather than allowing a healthy release of that anger in a way that it doesn't hold in the system. So yeah, it's also about knowing how to release emotions and that it's okay to do so.
How do you help them in that regard, Dr. Pedre? What do you like? What kinds of modalities do you prefer?
I've looked at different things over time. And I think freedom of consciousness journaling, just to write what's in there, teaching them to speak up but in a way that's respectful. But like, for example, if there's a boss that's causing problems, like giving them, empowering them with that voice to say something, I think is very, very important. Like giving the person back their power. And I don't do it personally with patients, but I've directed them to this, is tremoring, where you shake to release emotions from the body. And this is something that animals do in the animal kingdom. Like if an animal survives an attack, you might see the animal like shaking for a moment, and it's almost like it's shaking off the trauma in that moment. Well, humans, as we know, we don't do that. We hold things, we like lock them into our bodies. When I first started doing yoga, I was doing a lot of Iyengar, and Iyengar involves a lot of hip opening positions, stretches. And I used to leave, I was in my 20s, I was in medical school with my Iyengar teacher. And sometimes like 15 minutes after class was over and I was on my way home, I would just suddenly start crying. And I'm like, I don't even know why I'm crying. But it was like this release, because we hold a lot here in the pelvis. We hold a lot of emotion in the pelvis. And it's so interesting to, to talk about this, because as we started talking about the gut as the second brain, and we do feel emotions here, so a lot of times, another thing that I'll ask people if they're feeling something is, okay, so tell me, where in your body are you feeling that? If it's anger, frustration, it could be here in the chest, but a lot of times somewhere in the gut. And I tell them, well, imagine that feeling, that emotion is like a piece of ice. And I want you to take your mental energy and I want you to melt it. And I want you to breathe into it and continue doing that until it is completely melted. And even just doing that, it's incredible. I mean, I've done that in my office with patients, and it's incredible how within 2 to 3 minutes you can create a shift in how something was being felt, just by bringing that awareness to it and bringing the breath to it and just allowing that release.
Right. Would your treatment protocol for someone with depression still be the same in terms of getting them off gluten and dairy, or would you not worry about that?
Those are big instigators for the brain. There's so many studies showing how gluten inflames the brain, and you get all sorts of metabolites from gluten, like gluteomorphins, and the same thing with dairy, you get caseomorphins. So I think in a broad stroke, initially, yes, I clean out the diet, work on healing the gut. And then at the same time, because if there's depression or if there's anxiety, there are built-in mental patterns that go with that. So while you're working on that cornerstone, I also start working on the mindset, the belief system, the way the person views life. And we start working on both of them at the same time, because I'm not a patient person. I like to just move forward as quickly as possible. And that can sometimes be frustrating for my patients because I can really push them hard. But what I tell people is that, look, I hold the light of the greatest good for you, and I can see it. And I'm going to push you. So if it's over here and you're over here, I'm going to grab you by the hand and I'm going to pull you in this direction. And, sometimes I'm going to pull you really hard. Then I might see, okay, they're creating a lot of resistance. So I'll kind of slow down, be a little more nurturing. And then when I know it's time again, I'm going to be like, yank, like, okay, let's go this direction. And I work a lot on mindset, because if you've got to change the underlying mindset, or else any diet changes, any lifestyle changes you create will only be temporary, because once they get tired of holding that, if the mindset is still the same, they're going to fall back to old patterns.
Right, right.
And it can even involve like healing interrelational dynamics. You know, it could be husband, wife, mother. I had a patient, I've worked with him for a very long time, and had severe anxiety, lots of gut issues. So we started with the gut issues, found out that he was living in an apartment that was mold toxic, got him to move out of that apartment, moved in with his mom. He's in his 40s. And that brought back a lot of childhood trauma and interrelational dynamics with the mom that involved her, I guess, just using really negative words on him that would chip away at his self-esteem, and him not speaking up for himself. And during the process, we're working on healing the gut, healing the toxicity and all that. And also at the same time, working on healthy boundaries and saying what is not acceptable, you know, because you've got to work on that external as well as the internal. And he's come this particular patient, I feel like it's been like one of these like clays that I've been molding projects. He's been with me now for 2 years and has come so far, has started meditating, has like really his awareness of all of the patterns that were playing out, and even between him and his mom. So now his relationship with his mom is better. His relationship with his sister has healed, all as a result of all of this work that we've done together that started with the gut, but really moved on from there. Because I just say, you know, the gut for me is the entry point to all of the other work that I do with people, because the gut is a foundation, and yeah, it's really key and important. But like I said before, true healing is mind, body, spirit.
Do you recommend any particular vitamins or herbs to support the work as well?
Absolutely. So I work with probiotics. I work with gut healing nutrients like L-glutamine, DGL, deglycerinated licorice, aloe vera, marshmallow roots, slippery elm bark, maitake mushroom. I also will put people sometimes on omega-3s, some fish oils, on zinc as well. Zinc is really important, zinc carnosine, especially for healing the stomach. Digestive enzymes, and I tell people, you know, sometimes we have to use digestive enzymes in the same way that if you fell and you hurt your knee, you might have to wear a knee brace while the knee is healing. Well, digestive enzymes are like that knee brace for the gut. So they're giving the gut that rest that it needs from all of the work so that it can start to little by little heal. And sometimes patient has low stomach acid, and this is rampant worldwide. So we have to put them on some hydrochloric acid to help them digest their protein, which is, by the way, so key and important for mental health, because if you're not breaking down your protein properly into component amino acids, then you don't have the building blocks for the neurotransmitters that can keep you happy, like serotonin and dopamine.
Interesting.
Wow.
And also, I mean, I didn't even mention melatonin, but you know, everybody thinks of melatonin as a brain signal for sleep, but that's only the minor part of melatonin. It's like 94% of melatonin is produced in the gut.
Wow. Wow.
So insomnia could be another problem there with people with bad guts.
And well, and it turns out that melatonin does much more than induce sleep in people. In the gut, it's actually working as an anti-inflammatory. It also promotes the contractions of the gut lining, so moving food down the gut. And it's an incredible antioxidant, really, really powerful antioxidant.
Wow. Wow.
and it's banned in the UK.
Is it really?
Yeah.
Yeah.
Wow.
Yeah. Crazy. Yeah.
Yeah, let's ban things that are good for you.
Yeah, right.
Yeah, exactly.
And have a very low risk, you know, their risk to benefit is really low. So,
I
okay.
know, it's crazy. Tell us some of your favorite ways of, while we're just talking about supplements, of healing parasites in Candida.
Yeah, Candida can be challenging, and there I'll step between being a holistic doctor, functional medicine doctor, and a regular Western doctor, and sometimes bring in a mix of antifungal prescriptions as well as antifungal herbs like berberine, oregano oil, pau de arco, as well as caprylic acid. I found that caprylic acid in concentrated form is quite a potent antifungal. And then if I'm dealing with parasites, then I'm looking at black walnut extract, artemisinin, if I'm using more natural antiparasitics, and maybe in combination with berberine, olive leaf extract, things like that. And if I can identify the exact parasite, then maybe very targeted prescription antimicrobial, antiparasitic treatment, which sometimes, look, you have to do it. I had to do it in January once I figured out what parasite I had. And the minute I took the first pill, I started feeling better. So I knew I was on the right track. The thing is, and is very important, is with any of these treatments, you know, especially if you're clearing the field and you're using antimicrobials of any type, then you have to go in and refertilize that field with probiotics, fermented foods, prebiotic nutrients, so you can then reestablish the diversity of the good gut microbiome.
Are there any particular supplements that you really rate?
Aside from probiotics for people, leaky gut formula, omega-3s across the board, I think are really important. Depending on the person and their diet, maybe some mineral supplementation, multivitamin, but you have to make sure you're getting the right source. It gets quite complicated because you want to make sure you're getting nutrients in a form that's more bioavailable. And then I do a lot of different things with people depending on their individual needs, like mitochondrial support, for example, with nicotinamide riboside. That can be really key for energy. A lot of people think energy is a thyroid issue, and it not always is a thyroid issue. It can be a mitochondrial issue, which are the little energy factories inside all of your cells. And glutathione, liposomal glutathione for detoxification support, NAC for liver support, N-acetylcysteine, which is a precursor for glutathione, but also very liver protective. And depending on the demands and exposures of the person, I'm always thinking of the detox system and the 3 pillars of detox, which are the liver, the gut, and the gut microbiome. And if we're supporting the liver, then we want to support phase 1, phase 2 liver detoxification. Think of it this way. Everything that is being detoxified by the liver has to go through phase 1 and phase 2, and in that order. But phase 1 is Olympic sprinter, and phase 2 is a sloth. So the problem is that it can be one of those issues like in that I Love Lucy. I don't know if you ever watched I Love Lucy and the Chocolate Factory, where they started putting chocolates that they had to wrap in a little treadmill. And they thought they were doing so well that they said, okay, speed it up. And then there were so many chocolates coming that she was stuffing them in her bra, putting them under the chef hat. And you can think of it like your phase 2 enzyme can be easily overwhelmed if your phase 1 Olympic runner is going too fast. If your phase 2 is a sloth, it needs to be nurtured with the right amino acids. to be able to complete that phase 2 reaction. So supporting phase 2 with the proper amino acids, glycine, taurine, again with glutathione, NAC, to help support that second step in liver detoxification that is really key and important for clearing toxins out of the body and getting them into the gut, so making them water soluble so they can be excreted through the bile or in the urine. So those are among my go-tos, especially, you know, detoxification is so important in our current environment, where we're being exposed to all sorts of toxins that are coming from the air and even just from things that we put on our bodies, skin lotions, creams, all sorts of endocrine disruptors. And what people may not realize, so I said the 3 pillars of detoxification are the liver, the gut, because if you're not pooping, you're not clearing your toxins. And third, the gut microbiome, because the gut microbiome also can biotransform certain toxins and keep them from coming into your body. It can also work against you, and it can also go in, and I talked about that phase 2. So what does phase 1 and phase 2 do? So I'm going to explain it really simply. So if this is a molecule, it could be your own hormone, it could be a drug that you take that's being metabolized out of your body. Phase 1 comes and tags it. So now this molecule has a tag. That tag just made this molecule really toxic to you. In fact, it can cause DNA damage. It can create free radical damage. So phase 2 comes in, and phase 2 adds an anchor that binds to this piece. And now this molecule has been neutralized, made water soluble, and can be excreted from the body. However, you know, so for really important for women, because there's so much estrogen dominance out there, and that also, we didn't talk about this, but the connection between gut and hormone balance is really important. So that estrogen that was metabolized and secreted into the bowel can be cleaved. So there are bacteria in the gut, if there's an imbalance, that produce an enzyme called beta-glucuronidase that will come in and it will cleave this bond here. So now this metabolite, this estrogen, is free to circulate back into the body, especially if you're suffering from constipation, slow motility. Then there's more time for this to happen. And it can be estrogen, it could be endocrine disruptors that act like estrogen, like from plastics, from things that we are exposed to in the environment. And that also causes imbalances that we hadn't talked about, but the gut hormone connection, how important that is as well.
Mm-hmm. Are there particular, for people listening, they're going to want to go and look at products, etc. Are there particular brands that you think are better than others that you usually recommend?
Yeah, certainly. And I know this is a worldwide audience, but what I do, because this is updated on a regular basis, is the Environmental Working Group does incredible work in this area on looking at what products contain toxic ingredients. And I have to say, I don't know, I know European Union, I imagine UK also, there's about 40 some ingredients that are not allowed over there that we allow, because hey, why not? Industry has a big lobby here in America. So there's a lot of toxic ingredients that we allow in skincare and makeup and in skin lotions that you cannot find when you go to Europe, because you guys are a bit more careful than we are on keeping people healthy. But if you go to the Environmental Working Group, ewg.org website, and look at their Skin Deep database, you can look at a lot of the products that are potentially toxic, might have heavy metals, might have endocrine disruptors, petroleum derivatives. Really, really important to be aware of this, because it could be a factor in how a person is feeling. And it's something that they do every day. So they might not realize that what they thought was okay is actually unhealthy for them.
Yes,
Mm.
yes. And what about for supplements? Do you have particular favorite brands, both supplements and
Mhm.
tests, particular
Yeah.
go-tos for testing and
Yeah.
and brands for people
Yeah.
who want to take
And it
supplements?
could be, and of course, it could be different in different parts of the world. But in America, I have a whole supplement line that I created to complement my book, Happy Gut, and that can be found at happygutlife.com. There's also a company that I work with whom I designed what I think is one of the best leaky gut formulas on the market, and it's called Nature MD. So you can go to naturemd.com, and we've worked on some really great supplements together. The one I'm most proud of is the leaky gut formula, because I took my knowledge of what was good or what was missing in other formulas, and I put it together in this particular formula. And then there's other companies, for example, like in the UK, you have Metagenics, and you can get their products, and those are, quite high quality products. They do tend to be more expensive, but as a very close friend says, you can either pay the farmers, the the supplement companies and nutraceuticals now, or you can pay the hospitals and the doctors later. So it's really about deciding, what is worth spending on. And I really do think like you'll end up spending less in the long run if you take care of your health all the way along.
You bet.
Very good.
You bet. Now, is there one final question? If you were going to suggest some tests that people should take,
Oh, yes. Yeah.
What tests would you recommend? And what lab?
The biggest ones that I know of, and of course I'm US based, but the biggest ones are, for example, the GI map, which is a PCR-based stool study. There's other companies that do a mix of PCR and stool culture. So Genova is another company that's been around for a really long time, does some excellent stool testing, and they have a particular stool test called the GIFX profile. And what's really neat about that one is it gives you a gut diversity index. So you can see how diverse your gut microbiome is in comparison to a whole range of what's known from other people. And those are two really excellent tests. There's also another test that is called the Gut Zoomer. And that one also gives a lot of really excellent information. As well as people might not think this, but you also might want to check your urine if you're checking your gut. And what you can find in the urine are these metabolites called organic acids. So the type of testing is an organic acids test. And my favorite there, the Great Plains Lab does this. And they have, I think, the best organic acids profile, but Genova also has an organic acids profile. And I think Genova might be found worldwide in other countries. Yeah, I'm pretty sure that they are. These are really excellent, great tests. For hormone testing, if I'm doing any hormone testing to look at what's happening with a person's hormone balance, or even just cortisol and looking, and also melatonin production, my favorite test is called the Dutch test. And it's a urine metabolite test. I think it's the most informative out of all the hormone testing out there. I'm sure a lot of people have heard of salivary cortisol testing, but I think this is superior to doing the salivary test because it not only gives you cortisol, it gives you cortisol metabolites, so you can kind of see what's happening on the other side. That gives you a more well-rounded picture of what's going on with the person. So those are some of my top tests, along with doing regular blood tests like white counts, looking at C-reactive protein. That's a really important marker for what's going on in the gut. And of course, a thyroid hormone profile is always really important to check when you're thinking about gut health or even mental health, as well as hormones if they're appropriate. You know, hormone testing gets a little more complicated. It's different for men and women, and obviously different for women who are premenopausal versus women who are menopausal. So there's a lot of considerations there, but these are some of the really important tests, along with like some micronutrients, minerals, magnesium, zinc, selenium, and vitamin levels, like vitamin D, which is also really key and important for the health of the gut lining.
And do you test for leaky gut?
There is a test for leaky gut, but there's no perfect test. There's no perfect test. There is one called the lactulose mannitol test, but the problem with it is that I don't think it picks up every person that has leaky gut. And as I've learned recently, and this is, oh God, this is just opening a whole other can of worms, because I just gave two webinars on this. There's a whole other pathway for increased gut permeability that has nothing to do with the tight junctions, and it's connected to having the gut infected or colonized with certain bacteria like E. coli, like Campylobacter, that produce something called cytolethal distending toxin, CDT. And what that toxin does is it breaks down the cytoskeletal proteins inside the cells that line the gut. So before we were talking about leaky gut as a zonulin, high zonulin causes release of the tight junctions. So you get a leaky gut because the tight junctions between the cells, which are like Velcro, loosen up. But now there's a whole other pathway that's been discovered for gut permeability that doesn't involve the tight junctions, and it's because of this cytolethal distending toxin. So there are antibody tests that you can do that look at antibodies to cytolethal distending toxin, which is very common to find in patients suffering from IBS. You can also find antibodies to the cytoskeletal proteins like vinculin and talin. And you can also find antibodies to the tight junction proteins like the occludin as well as zonulin. You're not testing directly, like it's not like a direct measure for leaky gut, but it's looking for kind of things that you wouldn't find if there weren't leaky gut. So the idea is if you find these antibodies, then you can kind of conjecture that the person has leaky gut. But honestly, if a person is presenting with gut-related health issues that are associated with leaky gut, like headaches, migraines, depression, allergies, asthma, skin rashes, all of those, autoimmune disease, you can already start to surmise that the person has leaky gut. And if by story, they seem to have reactions to a lot of different foods, then that itself is building the case for leaky gut. So I will say that leaky gut is still, in my opinion, more a clinical diagnosis than something that can be easily diagnosed through lab work, even though we are looking for markers. And I know labs that are looking even for gut microbiome signatures for leaky gut to see if there's something that can be measured in a stool study that would let us know that the gut is leaky.
Before we finish too, can you just tell everybody your website again, Dr. Pedre?
Of course. The website is happygutlife.com.
Fantastic.
Wonderful.
Wow.
Thank you so much.